Yes. Hello, everyone. Am I audible?
Yes.
Yes, Arif.
Okay. So, welcome, Dr. Abby, Dr. Libin. And
Thank you.
I think, yeah, as scheduled, we are on time. So, we'll be proceeding with our discussions here. We have just 1 hour to complete this. So, we'll be going one after other regarding all the subjects, all the titles that we have already decided here. So, welcome, Dr. Abhi, and welcome, Dr. Libin. We are speaking on behalf of Mesh India. So, I welcome Dr. Libin to give a small intro regarding Mesh, this wonderful group. So, please, Libin.
Thank you, Arif. Thanks for that. If you may slide to the screen so that audience can see.
Yeah. Yeah. Hope it's fine.
Okay, I hope you can see the screen, right? Yeah.
Yes.
Yeah. Everything's fine.
Yeah, so for all the people who are gathered here, we just want to introduce MESH to all of you. So MESH stands for Mission for Ethics and Science in Healthcare, and we are a non-profitable organization registered now under the Travancore Kochi Act. And we consist a diverse group. We consist of a really diverse group of experts, and I'm not going to list out everybody who is in the list, but we have experts from all the different disciplines and professions here, ranging from teachers, lawyers, journalists, science communicators, physicians, and so on. So we all came together for one common mission or common goal, and which is actually what is mentioned here, which is to strongly advocate for promoting science literacy and fostering scientific temper, which is actually our constitutional duty, the Article 51H. And something very specific we want to address in mesh is that, like, we want to bring more awareness to the public and to educate the public about evidence-based medicine. What exactly is that is something which we will discuss soon, and really debunk quackery or pseudoscience, which is very prevalent in India, and also to fight against unethical practices in India, which actually comes under pretty much all the streams of medicine. Unfortunately, we have in India. I mean, it's even awkward to say different streams of medicine, but we do have unethical practices in modern medicine, or whether it's in homeopathy or Ayurveda and everything. So this is why we are together here, and this is our first attempt to actually go live and to bring some awareness about homeopathy, and to discuss about a recent paper which has been published by Dr. Abby Phillips and Dr. Arif, and we will go through this title, whether this is going to be a gentle placebo, or whether homeopathy is a reckless fraud.
Yeah. A gentle placebo or a dangerous fraud. That's the title goes here. So, Dr. Abhi, can you please start introducing about the paper?
Yes. I hope I'm audible.
Yes.
Yeah, loud and clear.
Yes. So basically, all this while, I mean, since last many decades, we've been actually talking about homeopathy being a safe placebo, in the sense that everybody you talk to a common person about homeopathy, they would just say that homeopathy is actually no effect, no side effect. That is generally what has been indoctrinated into the minds of people. But there has been a lot of large case series and studies. I mean, if you actually look at Professor Edzard Ernest, who's actually a complementary and alternative medicine professor, he's published a lot of data on how homeopathy can actually cause a lot of serious side effects, which include anything from allergic reactions to anaphylaxis, which is a very severe form of allergy,
Yeah.
to kidney injuries, to cardiac arrest, because there are some formulations which can affect the heart. For example, aconite, homeopathic tinctures containing aconite, this can actually affect the heart. And these have been well established. But there has been no actual good large series based on homeopathy related to liver injury. So this is where our paper becomes very important, because since last many years we've been, looking at and also studying patients who have been consuming a lot of homeopathic remedies for a lot of different types of diseases, and landing up with liver injuries, which we have very clearly established has been due to homeopathic formulations. So this is the paper that actually showed for the first time that homeopathic remedies are not really no effect, no side effect. Of course, they have no effect, but they can actually come with a lot of side effects. And this is what this paper actually shows.
Yeah. So one thing I would like to add to this is something from the perspective of an ex-homeopathic doctor. That is, throughout all these years, I was vocal about the problems or the kind of quackery homeopathy was promoting. Homeopathy itself is a quackery, and when I say these as an ex-homeopathic doctor, most of the people, my colleagues, my friends at my college, or many other people from the homeopathic fraternity, they used to tell me that, do you have any evidence with you to tell that homeopathy is a placebo or is a dangerous kind of therapeutics like what we are saying it right here? So at that time, it was not possible for me to give them some evidence from my part because I haven't done any research on my own. But what I was doing was to take all the papers that was already available from Australia, from UK, from many other countries. But now we are presenting in front of you a paper, just one paper, one among the papers, which was done from our own team, from our own resources, and we are presenting it to you so that finally we are eliminating that question that do you have done any research. So this one such a proud moment of producing such evidence to prove that homeopathy is not a gentle placebo, but it is a dangerous fraud itself. So yeah, please go on, Libin.
Thanks, Abhi. Thanks, Arif. Actually, I put the screen here because I want everybody to see the title of the paper and also the authors. And especially, I have taken that section from the conclusion of your paper and highlighted something. And this is exactly what we're going to discuss on, because every time you say that homeopathy is dangerous and homeopathy has side effects, like half of the people laugh right away. I like, maybe like 4 or 5 years before, I used to laugh, like, we know it's all placebo, sugar pills, and there's nothing inside that, and it's energy medicine, and how can that cause side effects? So I want everybody who is now viewing this live and also the audience who are going to watch it later to really see that things highlighted in the green, because this is something which is very important, and we need to address this part very clearly, and we need to bring this clarity on what is homeopathy, what is being sold as homeopathy in India, and how this can really make injuries. So, Abby, I'm going to quote I'm going to just read out what you have mentioned in the conclusion. The use of mother tinctures, insufficient dilution, poor manufacturing practices, adulteration and contamination, and the presence of direct hepatotoxic herbals were the reasons for toxicity. So we'll go through all of this very briefly, and for some of them in little bit elaborate, but I wanted everybody to keep in mind that, like, this is a very important part, and this communication has to be right. So that, like, when somebody says that, like, okay, there's a paper which says that homeopathy has caused liver injuries, you need to really address that. Hey, in this study, what exactly happened? What were the people consuming in the name of homeopathy, and what is the outcome of that? So
True.
I'm just gonna take some of like, I actually received a lot of questions, and I saw a lot of comments in Reddit, and I have been gathering myself a lot of questions. So since you both are the main authors of the paper, I want to take this opportunity to put myself a hat of a critic, and kind of ask you these questions. And I just saw this layout of this, and this is very clearly indicating like how the study was done. Like, start with large sample size, 456 samples, and then at the very bottom of that you show that you have final analysis 9 people. So this is something which, the people who does not fully understand
True.
how these injuries are being classified, they directly go with a comment saying that, oh, they took 456 people, but only 9 is homeopathic. Okay, so I want to first bring that to your attention. Like, Abby, can you please explain about very briefly about the study design, and especially the diagnosis of exclusion? Like, you have clearly this decision tree of things going different directions, and how you exclude different things into different components, and how you come at homeopathy. So when somebody says that, oh, out of 456 people, it's only 9 who has suffered from homeopathic injury, I wanted you to bring some clarity to the audience that, like, it why that 9 is important. Ideally
Yeah.
that should be 0, right? I
Just one
want you
thing.
to just go to that. Yeah. Yes,
Yeah,
Arif.
just one thing before going to Dr. Abbey. Actually, that point was already raised by a very prominent homeopathy
Okay,
professor.
there you go.
So I think, yeah, I think he has given a very,
You can
uh,
name the professor,
r-
no
yeah,
problem.
Dr. Mansoor Ali. Dr. Mansoor Ali. He has given
Okay.
a very, yeah, ridiculous example, and he has given such a. I think Dr. Abbey can add to that as well. that comparison.
Yeah. So the homeopathy practitioner Mansur Ali, I would
Yeah.
not call them doctor also. He's actually mentioned that looking at this table, he said that you have identified a lot of drug-induced liver injuries, but then ultimately homeopathy is only 9. So what is a big deal? So I'll tell you how exactly we come to that number. When we look at all the patients who have developed drug-induced liver injury from our database, we actually identify drug-induced liver injury due to any drug. I mean, not just homeopathy, but even in modern medicines, we identify them as a diagnosis of exclusion. For example, if somebody is actively drinking alcohol and they have been consuming some drugs on the side, we would never say that it is because of the drug. We would actually say that it is because mostly it is because of the alcohol, because that is predominantly known to cause liver injury. Similarly, all other causes like hepatitis B, other viral hepatitis like A, E, even dengue fever, like your leptospirosis, which is your very commonly found infection in Kerala. All of this we actually rule out, and ultimately we come to a very niche group who actually we think that the injury is due to some specific drugs that they have been taking. Even in that group, we go further into the rabbit hole and look at other associated factors. For example, if that person has an underlying cancer with an already jaundiced liver, or already there is liver failure in that, then in that particular situation, we rule them out again because we have competing causes there. So once we do that, we know that there is some particular drug purely affecting the liver. But that doesn't end there. We have to see that the person has actually started the drug, and then that association should be there. For example, he started a drug 1 year back and stopped the drug about 2 months back, and now he's presenting with jaundice. We don't call that as drug-induced liver injury because that was a year back. So basically, he has to start the drug, and there should be a relationship between the drug starting and the jaundice development. That is known as temporal association.
Yeah.
And once that happens, we apply certain specific criteria and then come to a conclusion saying that this is either possible, probable, or definite drug-induced liver injury. So definite is actually the best because it is confirmatory that it is the drug, but it is not easy to do that because for definite to we have to conclude definite liver injury due to a drug, we actually have to re-challenge that patient with
Re-challenge.
the same drug again. For example, somebody develops a liver injury because of a painkiller, and once he completely recover from that painkiller liver injury, we give him the painkiller again and show that this jaundice has happened again. That is not ethical because sometimes the second liver injury can actually be much more severe than the first, and he might actually die. So this is now taken out. So we are okay with probable and possible liver injuries as per the criteria. So once we did that, we looked at so many because we have a lot of patients coming with drug-induced liver injuries. We took the whole bunch and then we took off one by one because of all other competing causes, and ultimately came to a homeopathy-related liver injury in 9 of those patients. Now, the important part is if somebody, you can actually see that some patients were actually, some on the left side, you can actually see that some patients develop liver injury due to phenytoin, which is an anti-epileptic, or they develop liver injury due to atorvastatin, which is actually a drug given to lower cholesterol. The important fact to note is that phenytoin actually is good to control epilepsy, and atorvastatin is actually good to control your cholesterol. It is documented, it is studied, many people have it, and the risk versus benefit is much, much, much less. Benefit is much more, risk is much lesser in this. But when you look at the 9, where homeopathy has been consumed, we know that homeopathy is actually absolutely useless. And this has been studied over decades. And that 9 number should not be there. People with that 9 homeopathic liver injury should not be there. That is the whole point. So if somebody says that homeopathy is only 9 people there, that person actually does not know the value of life. He's not talking
That's
from
right.
a humanist point of view. He's talking like an animal with a vertebral column level of thinking. He's thinking with the spine. That is what Mansoor practitioner was actually saying.
Okay.
Abby, I just wanted to highlight something in this flow chart because I want to bring everybody's attention to this value called, all cases of DILI. The DILI standing for drug-induced liver injury, which is 243, out of which you actually removed some by multiple hepatotoxic drugs, and then you have actually 204 samples. And I have highlighted here in the green, which is actually by prescription drugs from the modern medicine. And which, as Abby rightly pointed out, there are a lot of medicines here which include anti-tubercular drugs, amoxicillin, and you have diclofenac, all these things, which are known to have an effect,
That's
and
it.
it also is indicated that it might have a side effect, and that's exactly what is documented. On the right side, what I shown in this red thing, which I think most people in the paper underappreciated, is the complementary and alternative medicines. And see that number, it's 151. So let me just put this clearly, Abby. This means to say that, like, in your clinic, you got 204 patients where you excluded other causes, like, reactivation of hepatitis B, autoimmune hepatitis. You got 204 patients of confirmed delay, of which, like, they have 50 people or 53 people with modern medicine drug related injuries, and you have 3 times more with complementary activated medicine. I want everybody to think about it. I want this thought to, like, sink into their mind. Like, when everybody takes that, says that, okay, the modern medicine have a lot of side effects, that's why I go for, Ayurveda or Siddha or whatever garbage you are going to consume. You have to understand that you are actually putting yourself into more risk of side effects. Is it right telling that, Abby?
Can I add
Can
something to
I
that?
say something? Yeah.
Sure, go
Yeah,
ahead.
that is. I think we can take a word, a simple word, that is risk versus benefits. Okay,
Benefit versus risk.
so yeah,
That's probably
benefits
easier.
versus
Benefit
risk.
versus
Yeah,
risk.
that's it. Yes, yes. So in that case, if you take diclofenac or paracetamol or arsenicum album 30, we know that we know that paracetamol has a benefit. We know that diclofenac has an effect, but there is also a risk associated to that. So we are weighing out the benefits and the risks, and then we are telling, okay, you take this right now, so that you get some goodness out of that. You might be getting some relief, so you take it. But when you come to arsenicum album or any other potentized, not the word potentized, diluted homeopathic medicine, there's no benefits associated to that. We'll come to the problem of mother tinctures and other combinations later. But when you take the high dilutions, there is no proven single evidence to say that dilution has a benefit, and still you are having risks to face, like these kind of which problems even leading you to liver transplantations. That's what we are seeing here. In that case, not even a single case should appear there, and at that moment we are telling the people like Mansoor Ali that it's only just 9 people. What is the problem there? So that's the whole point, I think, that you were trying to make. I hope that makes it clear more. Yeah.
Yeah, so to add to that question, you can actually see that complement and alternative medicines are much, much higher in this particular study compared to prescription drugs. That is your actual
Exactly.
So
medicines.
Yep.
This is not just my data. If you look at the data from the Asia Pacific Association of Study of Liver, the largest liver related body, apex body in the Asia Pacific region, they just published data on drug induced liver injury in patients with pre existing liver disease. For example, somebody who already has chronic liver disease or cirrhosis, they go for these or medicine, they consume multiple medicines and they develop liver injury because of those medicines, and then they develop liver failure because their liver is already bad at the baseline. So when they looked at that particular group that is already pre-existing liver disease and consuming drug-induced liver injuries, they actually showed that the highest number of drug-induced liver injuries leading to worsening of chronic liver disease in Asia is because of complementary and alternative medicine. It is not because of TB medicine. It is not because of antibiotics. It is not because of painkillers. It is not because of alcohol. It is not because of any of that. It is because of complementary and alternative medicine. So we are getting a similar trend here also, which means that people are actually harming themselves without the knowledge that they are getting going to get harmed.
Yep.
And this number actually says a lot of things. So people will say that modern medicines have, I mean, the common word they use is allopathy, which is actually, I mean, whoever is listening, please don't do that, because allopathy is not modern medicine. It is ancient primal medicine, medieval medicine, which was practiced in Europe ages ago. And Samuel Hahnemann actually gave that term because he wanted to discover homeopathy in the process. Now, when you look at all these prescription drugs that are actually causing liver injury versus complementary medicines causing liver injury, the number of people getting complement and alternative medicines related liver injury is much, much, much higher now, and it is
Yep.
ever increasing in different parts of the world.
Yep.
So this is what is happening. This is the real data at the moment in the current year. So all that modern medicines causing liver injury more than Ayurveda or homeopathy, that time is going to end now, because people are diagnosing more of patients with Ayurveda or homeopathy related liver injuries, and this number is going to go up. This will come down if people are scientifically more temperamental
Yep.
and people actually understand that these things are not useful for them.
True.
Thanks, Abhi. Thanks, Arif. I again wanted to, before I move away from the slide, I wanted that values to be in your mind. In this particular study alone, it's 3 times higher for the complementary and alternative medicine. I mean, like, it feels, it feels awkward to say alternative medicine, because we
Medicine,
don't have
yeah.
alternative physics or alternative chemistry, and then it's yeah. Anyway, Abhi,
Yeah.
I have taken a few other things from your slide. I wanted to make sure that audience really captures the depth of this. So this table in which you have shown here, the two things I highlighted in the red. One is the total number of days homeopathy was consumed. So out of these people who actually developed these injuries, the minimum is like a month, 30 days, and the maximum is like for 90, like for 3 months. So Arif, you were a homeopath. Can you tell me a disease condition where you take a homeopathy medicine straight for 90 days? And is it normal? That's what I want to ask you.
Yeah.
Or they want to wait
Most of
until body heals itself? That's a trick. I don't know. Like, please explain on that.
It's like, people come for a homeopathic treatment mostly for chronic conditions. Maybe they will be introduced to all these complaints uh, due to this, introduced to this homeopathy or any other alternative systems for treating their chronic illnesses, like maybe long-standing joint pains or some insignificant issues like that, or maybe even significant issues. So they start with something very lesser in problem, or in this kind of the degree of danger is less. But after gaining a confidence, because most of such conditions will go off on its own. We know that self-limiting, we call it.
Yep.
But later on, after seeing all this, they will start experimenting all these kind of medicines for serious diseases, like cancers and many other conditions, maybe hormonal imbalances, like thyroid complaints, and even infertility. We have seen people experimenting with this homeopathy. So in that case, it depends upon the nature of the condition that people will be taking the medicine, how long that they will be taking and all. So we cannot say that it's not 90 days as a mandatory period, but it can go up to 3 years, 4 years, and all.
Okay.
And there are even doctors who test it out just for 3 weeks or 1 month, or maybe 2 months,
And
and
they
then they
change
will
it.
stop. Yeah, they will change it.
Okay.
So that can happen. Yeah.
Sure. Thank you. I had one more thing to clarify. That is the second thing in the red, where the number of homeopathy medicines taken. And keep in mind, in this one, it is not that they have taken in the past, they have taken at the same time. When they all came to your clinic, they were taking up to 6
True.
remedies at the same time. This is where I want to bring an interesting conversation. So I have been to many of these homeopathy, like lectures to educate myself about homeopathy, and there has been this strong division within the homeopaths, where some of the classical homeopaths says that we give a single remedy. That's what our master Hahnemann has
True.
taught us. That's what is in the organon, or what is all this. Where is a bunch of other homeopaths says that no, you cannot really determine the real, from the totality of symptoms, you cannot really identify what is the right medicine, so you give a bunch of medicine. Most of the proprietary homeopathy things, even the so-called cough syrups, what you get in this, you can see a list of like 6 or 7 things. So
True.
when you were studying BHMS, I want to really know what was taught, to give a single remedy or give a bunch of things. I want to get from there. What is taught in BHMS?
Yeah, I think I would say that this dissonance of this cognitive dissonance that starts from the college itself. That is, you come for BHMS, you start learning homeopathy, the philosophy behind homeopathy, the all such textbooks, the organ of medicine, and many other things like that. And in all such textbooks, what is said in it is that you should practice single medicine. There is no combinations. You should
Yep.
stick to potencies and all. But when you start, you start your clinics by second year or third year, then you will be seeing that some doctors will be prescribing only single medicine, and few other doctors are prescribing all other combinations and all such things. And you will also see that to your, that will be something like the doctor who is prescribing single medicine, he won't be seeing more than 10 or 15 patients a day, or maybe a very less in number. But the other doctor who is giving mother tinctures and all such things, he will be seeing more than 100. So there will be a very vast difference. So what happens is the students will slowly bend towards the practitioner who is getting more number of patients, and they will start mimicking the kind of medications that doctor is prescribing. So that obviously is against the clinical,
Classical.
the classical teachings, or the clinical teachings
Okay.
that should be taken from the theoretical part. That's entirely different. So then starts the dissonance. Why is it like that? If you apply the theory in practicals, you will be failing. That's what we see in
Yep.
simple terms.
Yeah.
So by the end of your course, the biggest advice that an outgoing student will be getting is that, okay, boy, now you have finished all your academics. Now you are a grown-up doctor. But remember one thing: you have learned many things from the college, from your theory. Please keep it apart. It's not going to work. If you need to be a successful doctor, you have to prescribe mother tinctures, you have to prescribe many other combinations, and you have to
Yep.
try with many other things. Then only you can be a successful doctor. Don't just sit and cling on to the fundamentals. You will be failing. So please don't do that. That's the biggest advice we were getting from our college, and it's still happening in the colleges.
So,
So this is it, the
Arif,
reality.
thank you so
Yeah, I
much
mean,
for go ahead.
just to add to that, I think just to summarize that, once you pass out of a homeopathy medical college, the professors themselves are telling you that,
Don't look at the
forget
books.
everything that Hahnemann has said.
Yeah,
You can do
absolutely.
whatever you feel like.
Yeah, true.
Okay,
That's it.
I'm
so
glad
that's
this is
homeopathy.
documented. I'm glad that people are listening and, and understanding this. There's a reason,
And
Arif.
yeah,
Go
and
ahead.
I'm also glad that even for our first live, and I think this might be a history in the history of YouTube, that the very first video, very first live, we are getting more than 50 viewers here live with us, and that's a very big achievement for us, or a big start for us. Thank you so much for all the viewers who are with us now. Yeah, please go on,
Thank you.
Libin.
Thank you. Arif, there is a reason I specifically asked that question and you nicely clarified it because, that six number, that is a maximum number of
True.
multiple homeopathic remedies taken at the same patient at the same time. Okay, that has relevance towards the later in the paper, and how it's going to be relevant, right? Because that is exactly so. I want the audience to understand that, like, these people were on multiple homeopathic remedies or preparations. I
Yeah.
want to slowly switch gears into this figure. I mean, this figure baffled me because I still can't believe that, if I was sick and if I were to take any pill or a remedy, I will never buy any of those one. It doesn't have a proper label. It doesn't. It looks. The look alone says that it is a scam. Nevertheless, there are people who get strict to that and they buy all that and they consume all that. And I have taken this from your paper, Abby. Like, formulations were either classical homeopathy or proprietary non-classical products, which is a mixture by private
Yeah.
manufacturers. They included raw mother tinctures, labeled and unlabeled classical formulations. Okay, I can see that there is no labeling,
Yeah.
and by registered homeopaths, and without labels or content disclosure in form of globules or powders. My question to you, specifically to Abby and to Arif, the thing is, like, maybe first to Arif and then Abby, I'll ask you. Mother tincture. This is a word we need to explain very well
Yeah.
because everybody thinks about homeopathy. They think about ultra dilution and safety. I
Yeah.
want them to understand what is a mother tincture, and I want you to explain to the audience what a mother tincture is and why do homeopaths still use mother tinctures? Because we have audio evidence of homeopaths saying that we use multiple mother tinctures. And again, this
True.
is like a slap on Hanneman's face. I know that. So I want you to explain that for the audience. Were you taught again that the mother tinctures were the way to go? I wanted to get an idea on that.
Yeah, as I said earlier, mother tinctures was something that is forbidden for a true homeopath. Okay, the
Ari, first
true
maybe
classic.
maybe can you
Yeah.
just clarify the definition of mother tincture is so that the audience can understand what a mother tincture
Yeah,
means?
yeah, okay, sure. A mother tincture is, in simple terms, it is the mother substance of a starting homeopathic potency. That means you take any substance. For example, you take blatta. that is our cockroach.
Cockroach.
You can, yeah, you can
Yeah.
make mother tincture out of cockroach and the potencies. So to make the mother tincture, what you do is you collect, you you what do you say, you place all these traps, and you collect this cockroach, and you put all those cockroaches, live cockroaches, in a barrel, and you pour this alcohol into it. The cockroaches will die in maybe one day or 2 days, or maybe in a few minutes. I don't know when they die, but after that it starts
To, to
getting
decay.
macerated. Yeah,
Yeah.
decaying and macerated, we call. So after that, we keep it there for a few days or so, and there's a protocol, or there's a procedure for preparing this cockroach Blatta orientalis mother tincture in the homeopathic pharmacopoeia of India. Okay, we have the textbooks too. So in that you will get that, and after the prescribed time, you will press the juice out of that barrel from that cockroaches, and that juice is called the mother
Mother
tincture. You
tincture.
can make this mother tincture of any substance, even from honeybee,
Rat
or
poison.
from, yeah, rat poison, snake
Arsenic alcohol.
poisons, and
Yeah.
yeah, many other things. Okay, so that is the mother tincture. So when you start potentizing, what happens is you take a portion of this mother tincture and you add 10 parts or 100 parts of the vehicle, like alcohol or water, and then you mix it with that, and you shake it, and you get the first potency, that is 1C or 1X. If it is 10 parts, it is 1X. If it is 100 part, it is 99 parts, it is
1C.
1C. Okay, so you take one part from the 1C, and you add again this vehicle, you get the 2C, then 3C and 4C. And I think we have a very well elaborated preparation of one medicine by our pale blue thoughts. You might be Harpicum.
Harpicum.
Yeah, Harpicum toiletalis, that was prepared. Mother tincture, that is the Harpic we get from the grocery store. And we dilute it, and we make 1C, 2C, and we have made 30C. And that Anand from Pale Blue Thoughts, he has he drunk it actually on screen. Okay, so you can see that. So that is mother tincture, and that is how the potencies are made. Now, use of this mother tincture, it is forbidden as per the theory.
Okay.
Okay, for internal curative purposes, that's for sure. But the problem is, as I said earlier, for a successful practice, most of the doctors will go into such a practice where they will deliberately use these mother tinctures. And even I was such a practitioner where I used to give all the mother tinctures. We have even a book of mother tinctures for with indications, and the best indicated mother tinctures for the most seen diseases as well. So we have such literature works as well. But one day in my clinic, I was giving away these mother tinctures, and my pharmacist ran to my room, and she was like, doctor, there's something wrong with the mother tincture. I was mixing two mother tinctures, and it was giving out fumes, and it was turning into some milk, milky liquid. So even I was astonished, or I was panicked to see that. In fact, so I checked the case sheet, and I was looking at the mother tinctures. I don't remember the exact name, but I'm testing it out to find out that combination, which turns into a milk and giving out fumes when you mix two mother tinctures. That happens. So from that day onwards, I was thinking, oh my God, so if this can happen in our test tubes or in the bottles, this can even happen in our stomachs if we are giving it like that. It is turning out to be some toxic component, or some toxic medicine or something like that. It can harm you. So we shouldn't do that. So that's how I came to a conclusion that mother tinctures are having some serious problem, and we need to rethink on that. And I started going back to the fundamentals, and I learned that mother tinctures was not indicated, or was not a part of homeopathy. I have to stop it. And first thing that I stopped in my practice was use of mother tincture. So that's it. How is it in a usual homeopathic practice? Okay.
Okay.
Yeah, so
Abby.
to add to that,
Yeah.
so basically, I mean, coming to that cockroach,
Yeah.
so basically you have a lot of dead, decayed, and dissolved cockroaches in
Yeah.
a large barrel of
Alcohol.
heavy
Alcohol.
alcohol, 90% alcohol. Am I right?
Yeah,
And that
extra
is
pure homeopathic alcohol.
yeah. So some guy actually said as an argument on a paper that this is actually neutral alcohol and this
Yeah.
is actually harmless. So I mean, I mean there is nothing called as neutral. I mean there is something known as neutral alcohol, and it's actually very rectified, and that is actually
Yeah.
90%. And this is not like harmless. It is very harmful.
Yep.
And
Yeah.
people actually give mother tinctures of cockroaches for treating asthma, if I'm not wrong,
Yeah. True.
right?
Yeah.
So
Yeah.
homeopaths actually treat children with cockroach dissolved alcohol and call it a day. I mean, I'm not sure if people actually know that some of the products that they are drinking as part of homeopathy actually contains animal parts.
Yep.
Like for example, Ayurveda has animal parts like elephant dung and all that. No, it is there. In
We
Tanmantram,
have.
yeah, it
Yeah.
is there. And in homeopathy, I think there is much more than that. So
Yeah. We
people, when
have
you,
albatross,
yeah, I mean, yeah, you have even dinosaurs, if I'm not
dinosaurs.
wrong.
Yeah.
Yeah, there is a T-Rex homeopathy, and I don't know how they
Yeah.
got it, but still, I
Yeah.
think, but still, the whole aspect is that people should actually realize. You just look at the bottle and see what all is there in your stuff. I mean, you question real doctors about the medicines that we prescribe you. So do the same thing with homeopaths. Ask them if my syrup contains cockroach or lizard, or you can actually ask them, and they'll say, yeah, it contains some cockroaches, but it's okay. You know what to do then. Yeah.
Yeah. That's it. Simple.
I mean, that was the best reply I could expect. I actually wanted to be mindful of the time. I am transitioning to this slide. I'll keep the slide for a minute, but this question is for you, Abby. So this is going to be a very important question because when you did the when you identified these drug-induced liver injuries, and you know this because of the homeopathic preparations, you did liver biopsies, and something which you found, one of the very common finding you had in liver biopsy. Not everybody, but the vast majority of them had necrosis. So I want first you to explain what a necrosis is, and I want you to explain like what causes necrosis. What all things can cause a necrosis?
Okay, so when you say the term necrosis, it is actually a biopsy term. In simple sense, it's a
Okay,
pathological term.
okay,
So you actually see necrosis only on biopsies. So you can see necrosis in any organ.
okay,
So in liver, you call it as hepatic necrosis, or
okay,
within the liver, a lot of liver cells are lost. That is you don't see liver cells in many parts of the liver when you look at it under the microscope, and that is known as a necrotic liver. And necrosis can happen with a lot of causes. You can actually have necrosis actually happens with very severe liver injuries. For example, if somebody has a severe viral hepatitis and goes into acute liver failure, you can actually look at the liver and you can see that that viral hepatitis has caused necrosis. So severe viral hepatitis leading to acute liver failure is one cause of necrosis. Certain modern medicines which are not prescribed now, previously old world painkillers and old world antibiotics used to cause necrosis.
okay,
Alcohol does not cause necrosis, but
okay.
a lot of industrial solvents, chemicals like certain petroleum chemicals, these things can cause necrosis. So in this particular study, what we found out was that those patients who actually were very sick, who required a liver transplantation or who actually died in our study,
Yeah, yeah.
they actually had necrosis on biopsy.
Okay.
And this means that their liver was so badly
Damage.
injured that it lost its regenerative capacity, because liver needs some amount of a minimal mass to actually regenerate. Without that, it'll
Yep.
just die down and fail on you. And necrosis is a histological, a pathological counterpart of that. So what we saw in this paper was that patients who had severe liver injury because of homeopathic remedy consumption, they developed necrosis, and the ones who developed necrosis actually had a very bad outcome. Most of them died, and or some of them actually needed a liver transplant. In our series, nobody underwent a liver transplant. That is a different story. It has got to do with a lot of other factors also, and they eventually died. So necrosis does not happen with every drug. It cannot happen with
Alcohol
certain modern medicine. It never happens with
with
alcohol,
alcohol.
because
Okay.
alcohol has a very typical signature inside the liver. When you
Yeah.
have liver disease or severe liver injury due to alcohol, known as alcoholic hepatitis, you will see a lot of other findings. For example, you'll have a particular type of inflammation. You'll have specific deposits inside the liver cells known as Mallory Dunk bodies. You will have a particular type of scarring. Now, these are all well established, but you will never see necrosis. We
Okay.
had a paper where actually patients with alcoholic hepatitis had necrosis. We published
Okay.
that in Journal of Clinical and Translational Hepatology about a couple of years back. Alcoholic hepatitis patients showing so much of necrosis on liver biopsies. And the reason for necrosis was that they were consuming Ayurveda herbal drugs and homeopathic remedies along with alcohol.
On top of it, okay, okay.
Yeah.
So
So it
that is
actually
what
has.
Camilleri.
yeah.
So we'll have to mention about Camilleri and all such products which are marketed as some liver protective agents, and you can drink. That's
Detox.
how they are promoting it. Yeah, detox.
Yeah.
Yeah.
So there.
So I mean, the whole aspect of detox is itself is fraudulent. It's a
Wrong.
wellness marketing term because the biggest detox in your body is the liver itself. And if
Liver.
you're going to detox the liver, I don't know what you're actually planning to do. I mean, it's absolute nonsense.
I
Yeah,
mean,
true.
thanks for clarifying that, and especially thanks for defining necrosis and also telling the cause of necrosis. Or if you may transition to the slide part so that the audience can see that, I
Sure.
brought up this section from your paper where, from your analysis, you found that close to 46.7, that is almost like half of these drugs which you got from the patients, and when you went for analysis, right, you identified compounds, and especially this was something which you found in like almost half of this 2,4 tetrabutylphenol and acetaldehyde. It's called, for the short word of this is 2,4-DTBP,
BP. Yeah.
ditertbutylphenol. So I, on a curiosity, I went on a ride and checked it. What the heck is this? I want to know what it was. This is what actually I found. So basically, this 2,4-DTBP, one of the major components in volatile essential oils, and it exhibit potent toxicity against all the cell lines or organism tested, including the organism which itself produce it. It's produced by vast variety of species of bacteria and fungi and other things, and it is something called autotoxin. Like it produces its own toxin kind of thing. And I also found this is actually from the USDA, US Department of Agriculture. I'm not quoting it out of thin air. And the second thing is actually from the hazard map, HAZMAP, where I found that directly it's mentioned as adverse events hepatotoxic from occupational exposure or in animal studies or in humans after ingestion. Okay. And then I went to the PubChem. So this is now, I think, thanks for magnifying this one. The PubChem, just see the safety and hazards classification: corrosive, irritant, health hazard, and environmental hazard. And to every single detail, it has gone saying harmful if swallowed, causes skin irritation, causes serious eye irritation, causes damage to organs through prolonged or repeated exposure. So even to further validate all this, I in fact even reached out to a chemistry professor. I asked him if this is all true to make really sure that I get really an input from somebody who is a professor and dean of chemistry. And then he also says that this is actually true and this is actually a bad thing. So he also told this could one of the potential reason for necrosis. So Abby, I want everybody to understand. My question is that, first of all, is there any homeopathic medicine, Arif, which is made from 2,4-DTBP? Like, since we have T-Rex and from cockroach, I'm just curious. First of all, is there any medicine which is proven for,
Yeah.
or
I,
why the hell did this end up in homeopathic
so
medicine? That's my question.
I think you are clueless about how homeopathy works. That's why this question arises. Because
Possibly.
uh, yeah, because homeopathy works like this. That is, if a substance uh, causes a problem, then you dilute it and give it to cure the problem. So that's how it works. So the next moment, what you will be saying is that 2,4-DTBP
Oh,
30C or
30C
200C
to cure the liver
yeah, to
toxicities.
cure the toxicity of taking the herbal medicines, and you got this toxicity, and you can take this homeopathic medicine to get rid of that. So don't give such a valid clues for them.
For
Okay,
homeopaths. No,
for
actually,
homeopaths.
no,
Yeah, I
actually,
mean, so coming to this particular component that we actually identified in most of the homeopathic preparations, and this was actually from mostly from those mother tinctures and other
yeah.
liquids that they were actually having. This can, I mean, I'm definitely this is not a drug. Definitely, this is not a medicine because
Not
it's
a
Can
got
be,
yeah.
all
as
those
Arif said, it
logos.
can be made into a medicine. That's a different thing. Yeah.
Yeah, I mean, this
Yeah.
is not a medicine. I mean, we all know it. But the problem is that this now points towards another aspect of why homeopathy is a dangerous fraud is
Exactly.
because of very poor regulation
Yeah.
and very poor manufacturing practices. For example, if I consume a paracetamol tablet in Kerala by a company, and the same company markets a paracetamol tablet, and I buy it from Delhi and consume it, and I
Same.
check both, it will have only paracetamol in it,
Yep.
acetaminophen, and nothing else.
Yep.
Maybe some excipients which they will actually put on the packet saying that there are excipients like that.
Yep.
If I take the same paracetamol in the US or the Europe, I'll
Yep.
find the same stuff in
Same.
it. There'll be nothing else.
Yep.
But if you actually take a homeopathic medicine made by, say, Schwabe India,
Yep.
and you actually test a homeopathic medicine made by, say, Homeco, which is the Kerala government's
Yep.
homeopathy factory, I'm sure you will see a lot of difference between both.
Yep.
And
I
this
agree.
goes for all alternative medicine. So the whole aspect of good manufacturing practices,
Yep.
the whole aspect of homogeneous manufacturing practices across the same product is lacking. So if you actually consume a homeopathy tincture or a product today, the same homeopathy product from another company that you're going to consume the next week might actually kill you, because
That's
you never know you are actually getting the stuff that you are actually spending your money on. And this is actually a betting game. The whole
Yep.
industry, the whole homeopathy treatment is actually a betting game. You
That's
know,
right.
if you have a self-limiting disease, good, you are safe. But if you actually have a proper disease which requires proper medicines, and you're doing this, and you actually get a toxic product which was made poorly, you're going to have the disease effect on you plus the toxic product effect on you, and that is how patients land up in the ICU.
Yep.
and that is the single main point that we are trying to emphasize through our paper. That's the single simple thing. That is, it's not just a simple placebo. It is a dangerous substance too that you are taking, because we might have heard a comment made by the public during this COVID pandemic that at least it is homeopathy and it is safe. What is the problem in taking it? That is the simple question that was asked by the public. This is the problem. It is not safe. Even if it is safe, it should be having some benefit. It is not having any benefit, that we have given already the evidence for that. There is no benefit. But since you are saying that it is safe, even that is now getting debunked. It is not safe. So next time when there is another pandemic and when you are trying to take a homeopathic medicine, don't say that at least it is safe. It is not safe. It is dangerous. Okay. Yeah.
Yeah, so I mean, coming to the pandemic part, we actually have another paper
Yep.
published which
Yeah.
actually showed that
The,
the promoted homeopathic remedy, which the government and the Ayush ministry and all said that it is useful for preventing COVID, which is arsenicum album, which is arsenic trioxide
right.
diluted, that actually resulted
Killed.
in
Death.
severe liver injury and led to death of a person in our series, and we published that about a few months back, and that actually showed that particular product consumed by that person actually had arsenic in it. You know, you're supposed to, I mean, the label says it is an ultra diluted formulation, there is no arsenic, there is just magic in it which can cure you or prevent a disease, but poor guy actually found out that it had arsenic in it and it killed him. So this is what happens when you blindly follow unscientific promotion activities. So just because the government is saying it, just because a senior professor of homeopathy is saying it, or just because some guy you met on the road says that he's experienced it, doesn't mean that you're going to get the same experience. It might actually lead to your death.
Yeah.
Abby, thanks for rightly adding that, because when Arif told about the pandemic and the remedy, the first thing is arsenic trioxide or the diluted rat poison.
Arsenicum
And
album.
yeah,
Yeah.
as an album. And
Yeah.
and we all know that how infamous it is for toxicities. I'm just transitioning to the next part where I think I have captured some more details. So the most common thing which people come and comment is like, oh, he's the only doctor in Kerala who is able to find all these diseases. Nobody has anywhere reported any side effects of homeopathy. For those people who make that kind of poor judgment, this is for you. And I'm not putting an appeal to authority here. I'm not a big fan of World Health Organization, because World Health Organization is not a scientific body which rightly advises on many things. Nevertheless, here you can see that if you Google World Health Organization and homeopathy, you will see this document. I think it's closer on 40 pages, I guess. You can see the title of it: Safety Issues in the Preparation of Homeopathic Medicines. And I want your attention in this table. So in this table, they are trying to compare the homeopathic pharmacopoeia of India, which is highlighted here in the green on the right side, and you can compare with, for example, the French pharmacopoeia, you can the German one, and you have the United States one. Something which I found very striking is all throughout France, Germany, and US, they have very strict regulations on alkaloid content. You can see here alkaloid content expressed, and if you go to the Indian pharmacopoeia, it says not described or approximately whatever it is, and you can see the resulting alkaloid content, and it also says not applicable. I mean, this document is something which you all have to read. There are many places WHO specifically emphasize how bad the procedure is in India, and they also really point out the reasons, potential safety issues. And one of the two major reasons for potential hazard is, let me read it out, is related to the source material, something like arsenic trioxide, which is obviously inherently toxic, or procedures used for the manufacture of the finished product, which is basically the GMP they are referring. And they also write the GMP guidelines covering the manufacturing of the process, premises, personal packaging, and labeling apply to homeopathic medicines. And failure to apply GMP may lead to major quality and safety concerns such as misidentification, impurity of the starting material, very important, cross contamination or incidental contamination, and eventually leading to all these injuries and death. So this is something I'm trying to refer to, some authentic information which you can look on. Not only just there, one more small thing to add is something which you can find from the FDA. This is from the FDA website. The title is so striking. FDA warns manufacturers of products labeled as homeopathic for putting customers at risk with significant violations of manufacturing quality standards. I'm not going to read the entire thing. You can easily find it, but they clearly emphasize that these unapproved drugs, again, I'm going to read that one more time. These unapproved drugs. So in US, homeopathy is not approved because they know it's a quackery. In India, we have a ministry for it.
Yeah.
What a joke. Anyway, the unapproved drugs may cause significant and even irreparable harm if they are poorly manufactured, which can lead to contamination or may contain active ingredients that are not adequately tested or disclosed to patients. So I think I'm just trying to showcase some of these very major, agencies and, on organizations which are actually been calling out about the safety issues of this homeopathy. And I think this is something which people have to keep in mind, that it's not not a new revelation for Abby or Arif. Like, this has been known for a long time.
True.
um
That's it. And that part is hidden from the public by our
exactly.
policymakers and even our academicians. Even when I was at my college, these people, when we see some setbacks from around the world against homeopathy, like the Lancet paper or any other papers coming out, uh, all the teachers come to us and they just tell us that, don't worry, children, everything is fine. Homeopathy is booming in Europe, it's booming in USA, and it is booming even in India. So don't worry, we have this sales report, the amount of business volume that is increasing every year, so nothing to worry. So that's how we were pacified in our college time. But that's not the reality. There are issues, there are problems around the world, and especially with regards to the usage of public money. And that is the main concern of using such a public fund for this quackery, for this unscientific, without any evidence, such a thing which can harm people even. That's it. So we need to rethink about
Yeah.
all this. Yeah.
And just to end that, put a cherry on the top of that cake. Now I'm citing not from FD or WHO because homeopaths thinks that that is all drug mafia. So I'm quoting, in
Big
fact,
pharma. Yeah.
I'm now quoting a homeopathic pharmacy, which I think for the last 150 years or something they have been in India, right? The Wilmar Schwabe India.
Yeah, yeah.
Yeah.
It's a German company,
They have a
actually.
blog written by this doc called Dr. Aditi Sharma, who herself is a homeopath, and you can clearly see that she has mentioned about mother tinctures and side effects, whether she clearly emphasized therefore it's important to study toxic aspects of mother tinctures before using as a medicine. And mother
Yeah.
tinctures, that's very comical, are found to be effective for emergency use. But let's go. Let's just get around that part because that's not very relevant. And in the second section, she says mother tinctures contain material doses and active constituents of the drug. If used for long in macro doses, can cause toxic effects.
Yeah.
So
True.
for people who are still not convinced that, you can just
All
go
these
and
are
ask a
cooked up.
homeopath. The homeopath should say actually that we do prescribe mother tinctures. That is something very common, and these contain active components. I don't know how we call it homeopathy anymore, and Samuel Hahnemann will be devastated hearing this. And
Yeah, the idea of potentization, that itself came out after seeing all these toxic effects
exactly.
happening in the people,
Yep.
because Hahnemann discovered homeopathy in mother tincture. He was giving
Yep.
out the cinchona bark mother tincture.
Yep. Yep.
So he was seeing these reactions, and that was actually synchronism, we call it. It's an
Yep.
allergic reaction. And for
Yep.
that, he started diluting it with the water and later on with alcohol. And that's how this whole story of potentization came out. But now people are going back towards that mother tincture era. And even now, we have seen certain doctors from our country itself going against this mother tincture, usage of mother tincture, after seeing our paper that, okay, we had warned earlier, don't use it, but now see what is happening here. So just like that. So it's happening. Yeah.
Yeah, I think, I mean, just to add to that,
Yeah.
I think, I mean, when homeopath is actually prescribing mother tincture, I mean, in small bottles, I mean, I think it comes in 30 ml bottles, and I think
Yeah.
that is a maximum amount that you can sell that, because it's 90% alcohol or 80 to 90% alcohol, so you cannot sell
Yeah.
it more than that. So it
As
comes
per
in
rule.
30 ml. As per rule, that is a rule from
Yeah.
the homeopathy regulation that you cannot sell it
Yeah.
more than 30 ml. So,
Yeah.
but the whole aspect is that people actually ask me. I mean, I have some comments in the chat box where doctors are actually saying that they have identified people who are on homeopathy for a long duration developing alcoholic liver injury without actually consuming alcohol.
Yeah.
Right. So we have actually published that. We have actually published 2, 3 cases where we have identified people with severe alcoholic liver injury, and they are all teetotalers. They have not touched alcohol in their lives, but they have
You know,
been taking homeopathy. So the natural question is that they have been giving only drops. We are giving only small drops. So how can it harm the liver, and how can it cause alcoholic liver injury? Because for alcoholic liver injury to happen, you have to consume so much of alcohol over so many periods of time. That's a myth. What is happening is that they are consuming these 30 ml small bottles containing 90% of alcohol, and they're consuming like 5 to 6 of those bottles in a month, because the homeopath actually prescribes 6 to 8 drops every 4 to 6 hours or every 2 hours sometimes to kids, and they actually finish off 5 to 6 bottles almost in 3 to 4 weeks. That is actually very strong alcohol use over a month, if you ask me. You take wine or beer, that's like 8 to 13%. This is 90% alcohol. And they're
Yeah.
starting off at a very young age. Infants are getting exposed to alcohol in Kerala by the great homeopaths of prescribing mother tinctures here. And that is how they
Extra
develop
neutral
alcohol.
alcohol. It is extra neutral alcohol.
It's extra neutral alcohol. So it's actually safe for kids also. That is what they presume.
see,
It's
Yes.
Abby,
just absolutely
I am very worried that we might be sending a wrong message, because people who hear this, especially people who are alcoholics and drunkards, they will now realize that homeopathy is such a good alternative.
Yeah,
Probably
people
they will,
were asking here. Yeah.
people might completely take a transition rather than going to buy
Yeah,
expensive whiskeys or rums. They're
Libin,
gonna go and
this
buy.
actually happened.
This happened.
This
Yeah,
actually
that happened.
happened when there was a big lockdown on alcohol, booze manufacturing and sales in Kerala. The maximum number of sales of
Zingiber.
I mean, the other alcohol was from Ayurveda shops.
You
They
gotta be
actually gave
kidding
a
me.
lot of Ayurvedic.
No.
I mean, Ayurveda has a lot of alcohol in it, so people are boozing on that. Now, what is
Yeah.
going to happen is that they will get tax-free alcohol. You can just order it online, and it'll come home in boxes. That is how we actually checked a lot of alcohol products from homeopathy manufacturing companies recently. We just ordered online, and we got like 30 ml, 90% alcohol, like about 50 bottles delivered to the hospital. They delivered alcohol to the hospital. Can you imagine it? And then we checked that, and it was completely pure alcohol only. It was 90% alcohol.
90, 94. Yeah.
Please don't consume that, because it's not just going to be alcohol. It is going to contain a lot of stuff like cockroaches and lizards also. So please be wary of. And I mean, if you think that is a good exotic cocktail, fine. But don't consume homeopathic alcohol, because it's really bad and it's really dangerous stuff.
Yeah.
Thank you,
True.
Abhi. Thank you, Arif. I actually want to move to the next section where I wanted to really emphasize on how you were making the conclusions. And I really like you already explained about, the probable and possible and, all the different conditions. And these are extracts from your discussion part of the paper, where how exactly is the diagnosis of exclusion done and how you draw those conclusions. And you can clearly see that this demonstrates that adverse liver-related events due to homeopathy were mainly related to the use of concentrated forms, which is mother tinctures, adulteration, contamination, insufficient dilution, and presence of alcohol. Something exactly what WHO has been saying, FDA has been saying, all these things. And the same thing you put it here too. You say it strongly supported the use of homeopathic remedies and the most probable cause of delay. So now I'll take a pause here, because there are some people who actually studied medicine, but they have some scientific knowledge but no scientific temper. And they say that, oh, this is only 9 people. Okay, they have worried about sample size, and we let's get around that part. And they say this is a retrospective study, like, you are looking backward and understanding. So this is not a very good body of evidence. You need to do a double blind placebo controlled clinical trial. So I want Abby you to explain briefly about this study design, and why a probable cause. You already mentioned definite cause is tough, because ethically you cannot challenge a person and get an injury when you already know this can cause an injury. For fun, you cannot challenge them again. I don't know how I'm going to write to ethics committee that I'm going to write a grant proposal saying that we have known injury with this medicine, but I want to confirm it. I have this many participants, I'm going to challenge them again. Ethics committee will tear apart that proposal anyway. But I wanted other people to understand, like, why you don't need a double blind placebo controlled clinical trial to prove this. But all around the world, people have been doing similar diagnosis of exclusion, RUCAM scoring, and everything. So can you just clarify on the study design and why it is still a high body of evidence? Thank you.
Yeah, so I think this is, I think, the most important question of this session, because whenever we put up studies on alternative medicine related liver injury or any other organ injury or a side effect, people will actually come and saying that, this is not an RCT. I mean
That's
that's
it.
because they don't know it. I don't blame them, because even for me, I studied RCTs properly when I was in my DM training, and it's not easy. But people just know these terms and then they just use it. The whole aspect is that there are different methodologies in scientific clinical practice evidence generation which we follow, and RCTs, randomized controlled trials, are actually done to study an efficacy, a benefit of a particular intervention. It might be a drug, it might be a procedure, it might be some intervention. So that is to study the benefit. So while you study the benefit, you will actually understand the adverse events also during that particular time period. So that can be a side effect that can happen very early on during the intervention, or it could be a side effect that can actually happen much later on. For that, you need to have an RCT that goes on very long. Right. So that is why RCTs are done. RCTs are not done to understand or identify side effect. It is to study if benefits or good effects of a particular intervention. Now, coming to how do we actually study adverse events? So you can do it in two ways. One is you actually look back at your large database that has been collected over the years. That is a retrospective observation. You take particular groups of patients like we did. We found out a lot of patients had jaundice. Then we looked at all the causes of jaundice. And ultimately, we found out that there is a group that actually has jaundice because of certain drugs. Then in that group, we looked at modern medicines, we looked at homeopathy, we looked at Ayurveda, like that. So that is retrospective observation, and it is a cohort study,
Yeah.
which is a very good study to start off with.
Yeah.
Now there is another method that is known as maintaining a prospective database. So this happens in highly developed countries like US and Europe, and even in Spain and Brazil also they do this, where they actually keep a database of drug-induced liver injuries or drug-induced kidney injuries and prospectively collect data. For example, they'll say that we are going to start collecting data from today onwards regarding all patients who come with jaundice. And if we identify some drug has caused the jaundice, we will enter that into this database and we will assess the whole database after 10 years. So in 10 years, you will have a huge database which you have prospectively collected into the future, and then you are going to analyze it. So that is how the drug-induced liver injury network in the United States work. They all started off with retrospective, and now they're maintaining prospective. But in a country like India, from a single center, we can maintain a prospective database, but it should be a high volume center for us to actually have a large data for that. So in such cases, looking back at already collected data makes really good sense. And very importantly, once you have the data in, for example, now we know that homeopathy can cause liver injuries, and we know which all drugs in homeopathy
Very good.
can cause liver injuries. Next time a patient comes, we can actually collect that data and keep. So it becomes a prospective database automatically, because we know something, we are going to build on it. So this is how we actually analyze adverse events related to liver injuries or any other organ injuries in clinical practice. So you don't need an RCT for that. And ultimately, when somebody actually looks at all the data on homeopathy related adverse events sometime in the future, maybe after 20 years, they will do something known as a systematic review and a meta-analysis of observational studies. And that will give us the highest level of evidence on how bad a homeopathic medicine can actually be.
As you say, I just got it in the screen. This is
This is
exactly
what.
systematic review and this is systematic review and meta-analysis.
This
And
is what
this
it
is
is.
exactly what Abby just spoke. So, this is
Yeah.
one from 2012, another much recently, actually 2020. The second one is actually from 2022.
Yeah. So
And
the
they have,
guy who said nine is very less now
yeah,
will be
yes,
waiting after 20 years because that'll
Yeah.
be 900.
Yeah, that's it. One thing, just wanted to add here. We have even other instances of efficacy, which was seen well before, after starting this RCT, and this RCT was called off because that was found effective, and that too even happened. It's not about completing the RCT itself. We can find the efficacy well before as well. So that's also something that can happen. Yeah.
yeah. So I want to emphasize that just on last point, which Abby told, that we have systematic reviews, which is a collection of body of literature which is already published, and meta-analysis, which is further analysis of a body of evidence, and then we have clearly come with a lot of evidence that homeopathy causes adverse events. I actually put this one. I didn't. This was something which, um, like, I don't know what to say. Like, it was a bit emotional for me too, because for as a parent, it's very hard to see, you know, children die because of taking homeopathic medicines. And this really happened. Like, there are like more than 10 children who died and more than 400 people who got adverse events because they were using some homeopathic, chewing or teething pills.
Teething pills.
And
Yeah.
exactly, and this isn't back in 2016, and this was a big discussion back then. I think all the homeopaths in Kerala put it under the rug. But this is something which every parent has to think. Like, first of all, you might have a belief, and you might be thinking you are protecting your child because you're going to homeopathy assuming it's safe. But what will happen is probably things like that. This is this is a very important slide, and actually this is a discussion also I brought before about mother tinctures and about potencies. So what you see in this picture is actually some event which happened back in 2010. This is a real thing. There are more than 300 activists all across UK, Canada, Australia, US. They were overdosing with homeopathy, potentized homeopathy. Okay, let me clarify that. Potentized homeopathy. Actually, they took arsenic album, so which is like arsenic trioxide, and they knew that it's gonna do nothing, and they all were drinking it. This is a real photograph of activists just coming together and telling that this is really a scam. There is nothing in it. It's purely placebo, and they drank it. And I was
1023.
thinking,
Yeah.
yeah, I was thinking that, like, the one way to educate people in India is like, you go there and buy a bunch of arsenic album, and a lot of people us gather, in front of secretariat or something, and then, we can also drink like that. However, knowing how bad the GMP is currently in
It's
India
very
and
dangerous.
how
Yeah.
many injuries we are having, I would never now challenge it. That is why I put it. Will you take that challenge now? I mean, if I know that it no, I won't
No.
do that because
Not in India.
yeah, this was my strategy of educating people. Let's do this. But in
Yeah.
India, with the mother tinctures and all this crap out there, I'm not going to risk myself. And I want this message for the people to understand that this is not as safe as how they were doing it confidently because they know they are getting the right thing, which is they diluted the arsenic album, the life out of it, so that there is not a single atom of arsenic in it, so they can take sugar pills, and that's all that happened. But this is something we should keep in mind. And what I put here on the right is basically from the organon of medicine, where the father of homeopathy, Samuel Hahnemann, has written that the smallest dose of the best dynamized medicine has the far more healing energy, the energy medicine. So you get the most medicinal energy the more you potentize, and it even says that the smallest dose can therefore be entirely only of pure, freely developed conceptual medicinal energy. Like, the reason I put that is because, like, I can take any bottle or anything and fill it with some sugar pills and close it with a cap, and I say that, like, hey, this is a homeopathic preparation. When I open the cap, the energy which cures your disease into the vital force, it's not dissipated. The energy is still there and you eat the pill, and the energy somehow interacts with your spirit like vital force and then cures a disease. People have to understand schematically what BS is this, like, they have to understand this. So that's why I put it
That's
there.
why.
Yeah.
Yeah.
Or people have to just read Harry Potter.
Yeah. No, that's why we used to say that you have to keep the medicines closed. Otherwise, the spirit will escape.
No, no, I have
And
heard this
actually,
square.
the spirit will escape. All the alcohol will evaporate.
Yeah. Okay.
That's true. That's
And
certainly
just
true.
one thing. This is the video which I watched with that 2G internet back in 2010, and I was struggling to watch this, and this sowed the seeds of skepticism against homeopathy in me back in 2010. Thanks to these people. 1023
that's
homeopathy, there is nothing in it. Yeah,
that is that
they
is
are the people. Yeah,
that is good to know, Arif. I'm actually coming to the last part, which is the benefit to risk ratio, which you actually told in the very beginning itself. Because anytime you take a medicine, you have something called a benefit, and you get a cure. And all the very same time, you assess the potential risk or adverse events and see that whether what is coming more is a benefit much on outweighing over the risk. Then you advise it. In homeopathy, there have been so many studies done to study the efficacy or technically whether the drug is effective or not. And I'm just putting a very few screenshots and explaining to everybody who are homeopathic bucks in India that what is happening outside India. How is homeopathy looked at? So we had this famous article in 2005 which says in the Lancet, which says the end of homeopathy. You can clearly see that after this article came in, the end of homeopathy, I think there was a wave. And Arif, you might remember, right? You were at the
yeah,
time
true.
in BHMS, and
Yeah,
you were all
second year.
sad. You were sad,
Yeah,
and at the time, teachers came and told that don't worry, homeopathy is going to thrive and everything. But
yeah,
over the time, see what happened outside India. There's a famous Australian report back in 2015 which says that it is not effective for any disease condition. They removed it from their public health insurance. This is actually the university in actually Spain. I think Barcelona somewhere. They completely scrapped it because it's nonsense. I like the way the journalists put up the title. I wish more journalists in India write articles like putting these strong titles. Like this is something I liked. Kudos to that
yeah.
locals in the Spain newspaper. In Germany, the homeland of
The Mecca.
homeopathy, Mecca of
Yeah, the Mecca.
homeopathy.
Yeah,
Now the Mecca is in Kerala. We have to admit it. Now the Mecca of homeopathy is in Kerala. But once upon a time, where Samuel Hahnemann was there. Yeah. So German minister calls out to cut homeopathy treatments not on the public insurance. NHS ended it long time ago in the UK. It ended. France stopped reimbursing people for homeopathy, and they also stopped cutting everything. This is what is happening outside India. So I want to just take all this into consideration and think for a moment, like, why are we going backward? Why are we ignoring all this extensive body of evidence of no efficacy, having side effects, and then still having this blind admiration for homeopathy and promotion by the government? So I want to put this like a discussion point for Abby and Arif. Do you think that what is the outcome of all this? Like, I only think this is going to get more popular. Now the popularity is going to be again on rise. But I really wanted to ask what is particularly wrong with our public or our politicians, or do you have
yeah.
No, I mean, in a developing country like India, I mean, we can't compare ourselves to France or Germany or
I
the
agree.
US.
I
We
agree.
can't because we are very resource poor, especially when it comes to healthcare. Our budget spending for healthcare is actually pathetic
I know.
because a lot of money that is supposed to come into actual healthcare budget is going into Ayush, and a lot of that is actually going into research in homeopathy. I'm not sure
What?
how one can have two placebo arms
No,
in a study for
the thing
research.
is,
Only
can I
two
clarify?
placebo arms.
Research
Yeah,
in homeopathy itself is an oxymoron, right? Because it
yeah. I mean,
contradicts each other.
yeah, I mean it's like you're comparing two placebos. You
Yeah.
can you can never have a randomized controlled trial, placebo trial in homeopathy because you're going to compare only two placebos.
Two
It's that
placebos.
stupid. And because we don't actually have resources here, what happens is that a large number of catering in the in the rural areas and also homeopaths are actually a big bank of doctors which a lot of corporate hospitals use to run their ICUs and stuff like that because you just have to pay them peanuts. So if you actually want
Oh,
to keep
okay.
an MBBS doctor in an ICU, you have to pay them a little bit more. But you actually hire a BHMS or a BAMS person, you don't have to pay them as much. So this culture is there in our country,
But
and
Abhi,
this is
are they sorry to interrupt? Are they legally allowed to treat
this
in
it's
ICU?
not
Because
legally allowed, but it happens. It's an open secret. A lot of them actually work, and this is what is happening. And a lot of them actually go and work in these conditions, learn a bit of medicine prescriptions, go back to their rural or suburban place, and start behaving like a proper doctor and prescribing modern medicines. This is what they do, and they end up screwing up patients totally. And because of this, and because of we have this that gap, homeopathy will survive. And it is also a lot of business because you see, a lot of governments have invested a lot of money into their homeopathy industries here. So they will not just let it go. So it's mostly to cater to businesses and to cater to that gap in a very illogical manner. So, and the most important is the only reason homeopathy survives in Kerala or in India is because of the absolute stupidity of the people here. And by absolute stupidity, I'm not calling anybody stupid. I'm calling them I'm
Lack of
calling them out because they actually do not understand that their personal experiences is what is driving the homeopathy industry.
yeah,
Not evidence, no studies, no benefits, nothing. It's just personal experiences
anecdotes.
from the patient, and also that personal experience is made into videos and WhatsApp chats and whatnot by the homeopath, and that has been circulated, and that is how it is surviving. It's actually surviving like a cockroach. We started off with cockroaches. You
Yeah.
can't just kill it. It's so difficult because experiences matter for the common person. So if I say that homeopathy did not do anything for me, some guy will say that no, homeopathy did this for
No.
me. That
Yeah.
experience is so powerful and it doesn't make any sense. But homeopathy will keep surviving only because people are not or are reluctant to accept that their personal experiences are not actually evidence. That is the reason.
Yeah.
Abby,
Yeah.
I think you
So
nicely answered this. Arif, do you have anything to add more on to what
yeah,
Abby asked?
yeah,
Yep.
just one thing, that is the transition will definitely will happen. That is, more people will realize the futility of homeopathy, and there's no point in supporting it or taking it. But for that, the number one the technological aid that is being utilized here will be the internet, because more and more people will be getting more information, just like what we are doing here. People will be getting all these, and they will be coming to know about the problems, and they will start moving away from homeopathy, and more people will start learning, and later on that can that transition will snowball. So but it takes time, so let's do our part well, so that they can do their parts too.
So I
So
want to
yeah.
end this with one point that is in a good way. That I recently received some messages from a particular source, a very good source, who actually works with Capsule Kerala, which is a group in Kerala that works against quackery. So he was telling me that in Kerala, a lot of homeopathy seats in homeopathy colleges are empty. Even in after third and fourth counseling of NEET, nobody has taken it. The, the,
Okay.
the number of people taking up homeopathy as a profession and career is actually coming down in Kerala. And I think it should come down in Kerala first so that it
Yes,
can then
Yeah,
go out. Yeah, so this
exactly.
is
that's it.
happening. So this is
True.
happening on the ground, and people are realizing that they don't have to defraud other people to make money and have a good life. You can do a lot of other things for that.
Yeah. So thing
True.
is that, like, when we do these videos, and when people always ask, like, what is your aim at the end? Do you want to ban homeopathy? Like, there's no country, in spite of all this being pseudoscience, nobody has banned it. So I wanted to end this session with a note that, like, what exactly is a mission that we are trying to do. And I give an example here on the screen. Like, this is something which the government of Canada has done. We have the government of Canada is from the Health Canada website, and you can clearly see how it is labeled. So for any homeopathic product to be sold in Canada, they say that these claims are based on traditional homeopathic references and not modern scientific evidence. So this is coming to all of these homeopathic preparations. Whether you go to a drugstore and buy the homeopathic preparations, you see this label on top of it. So I think that something like this, if it can come in India or in Kerala, where Kerala is very literate, so everybody can read it, there will be
True.
some change, but not a big one. Like, the thing is that I always thought, like, if you are a homeopathy buck, because you have a lot of anecdotes, it's just like somebody who consume alcohol and they read, okay, alcohol is injurious to health. Okay, again, you drink alcohol, or you scare the crap out of people by showing that smoking is injurious to health, and show the pictures of the necrotic, whatever, the lung and everything. Still they smoke. So I think this is what we need. There are people who might be so much addicted to homeopathy, or they have their own personal experience. They might read it very well in Malayalam or English or whatever mother tongue they want to read it, and and then they will probably consume it. But there will be still some fraction of people who are like, they're not aware of any of this. They will probably read it and say, oh, okay, this is not based on modern scientific evidence, so maybe I should not try this. So that is a change actually I anticipate. I mean, if that happens, like, this is what happening in most countries, like, that the same thing happens in US too. In most of the US, if you go to drugstores, you can see the same labeling. If this is a kind of thing which is just a small step to some extent, but I think this is something which we should be communicating more, like, even to the government. We can tell the government that in spite of all this mounting evidence, and even if you put this label, people will still buy it. So we should assure them that people are so only buy it anyway, and but these labels will help a few people. to read it and understand and come out of it.
True.
So I
Yeah.
think, yeah, I mean, we are almost close to 1 hour and 20 minutes. I don't want to take it too long, but Arif, can you see some comments coming from the audience?
Um, yeah, actually, I was just going through that those comments, and what I seen there is that apart from a few doctors joining us with their own examples from their clinical practices, like I have start here, 2 3 messages here, so I'll just show it here. One is from Dr. Venkatesh. So he was mentioning about this, yeah,
Renal
renal
pathologies
pathologies.
do occur
Yes,
with prolonging of dangerous homeopathic remedies.
homeopathy
I have
remedies.
come across memories. It's not
Yeah,
So this
so
surprise.
is
membranous nephropathy is because of mercury mostly,
mostly, yeah,
and a lot of these preparations do have mercury. So probably this is because of mercury toxicity in homeopathic remedies that he's seeing.
yeah, yeah.
Abby,
Then
if
and
I'm
one another, yeah,
no, go ahead, go ahead. No, I was
yeah,
about to say
another,
that in that systematic review, I think it is not probably this particular injury, but I saw a mentioning of the renal injury. So kidney injury in one of the systematic reviews I just brought up to the screen, just to add to
yeah,
that.
and
Yeah.
yeah, another one from Rashid Khan. He's saying that I'm seeing very young non-alcoholic patients with liver changes who are on homeopathic medications. Another one.
This is exactly what
Exactly
we
what
discussed.
Abby
What we
was
are,
is discussing. Yeah.
yes. And one final message, it's from Jabin. In our PG Homeopathic College, we do RCT and
RCT.
write whatever data we want. This is how we got our MD done. This is the
Arif, I had a question for you about drug proving and how you did drug
yeah,
proving when
exactly.
I ignored it. Yeah,
No, I
you
mean, this
just
is
think,
exactly how they did the arsenicum album study in Kerala also.
yeah,
exactly. Yeah,
yeah,
the
that's it.
infamous
Yeah.
study with,
One
yeah,
fine day, they just wrote a
Pathanamthitta.
Word
yeah,
document and submitted it as a paper, PDF form, and circulated it. That's it.
in
They
research
were,
gate. Yeah, yeah.
yeah, they were just that deja vu moment of their PG times. Anyway, this was a wonderful time, and I think this have given a very good start for the mesh activities. So I thank all the people here who were reviewing us in literally. So we'll be having all these kind of discussions at least 2 4 times in a month. That's what we are planning with different topics, not just homeopathy or Ayush debunking. We will be even talking about not just pseudoscience but also about bad sciences like other ethical and scientific issues, even in modern medicine as well. So we'll
Yep.
be talking all such aspects. So I think we also will be forming WhatsApp groups or Telegram channels or groups for getting ideas and other updates, to give away updates to the public as well. So I think we can wind up here. So anything
Wonderful.
more to add, Dr. Abby and Libin? All good?
So
Yeah.
Abby, you can go first.
Yeah, I mean, thank you for joining in, and thank you for to Arif and Libin actually made the whole PowerPoint presentations and gathered all data for so that we can have a fruitful discussion. And special thanks to all those who joined us and for all the comments in the chat box. And I think we'll do this much more frequently from now on, so that we can actually have an important. I mean, we'll talk about a lot of important aspects, not just in pseudoscience but also in medicine, just like Arif said. And as a first episode, I think we did quite well, and I'm very happy that we had many people joining us. So thank you, and have a good night from my
Yeah.
side.
Thank you. Yeah,
One
thank you.
last thing
Thank
to
you
add
so
is, like,
much.
always when we finish a session, it's good to give a one take home message. And from my end, after looking at the papers from Abby and also looking at all these warnings from WHO, FDA, all the injury systematic reviews and meta analysis, the one take home message for anybody who is listening to this is homeopathy is not necessarily always safe. If you have a bad GMP, good, if your manufacturing process is bad, if your starting material is inherently toxic, and if you are consuming large amounts of other substances like proprietary medicines and everything, it can harm. And as I told you, like, I will not take that challenge anymore, like like what was done in the humanist group in India, because particularly in India the regulations are extremely bad, and you have to be cautious and careful when you take a homeopathic medicine. So this is a one take home message I want to give to all of you. And
Thank you.
I think
I second.
you second that.
Okay.
Okay. Yeah.
And I think from my side, a take home message would be to please don't consume anything without labels on it. I mean, I don't know how people do it. Don't take anything from any doctor, I mean, presumed doctors, without any labels on it. Unlabeled products, please stay away. And if they're labeled, please read the label. You can actually read the label and see what you're consuming. This is all you need to do. That's it.
And if there is a label, and if the doctor is claiming something high about it, then again you have to be cautious and you have to look for evidence and then take it. That's it.
I mean, one
Okay.
last ending note. I think I know why you told about the label part. I think I recall a conversation
I
with
think
with us
I
where you sent to the
yeah.
lab an unlabeled sample and the machine almost blasted, right? Because it
Yeah.
contained heavy amount,
Yeah, so that was an Ayurvedic product, and my
no
lab
label.
partner's gas chromatography column actually
Yeah.
just
It,
went
it
off.
was yeah. They used
It
one
stopped
word.
happening.
So please label how much high the metal is. So
So they basically asked me if I've actually given
that
them something that I have taken off from the road. They said, "Are you giving us some industrial product that was lying on the road? You have taken the tar or something from the road and given us to examine
Yeah.
because this contains so much of mercury and arsenic." I said, "No, this is actually
Yeah.
pure, very safe and natural Ayurvedic medicine."
Yeah. I think I don't know the exact word in English to tell about. They were telling it adichu boy.
Yeah,
You can
that's
it,
you
it,
can
it blasted off,
boom.
kaboom.
boom kaboom. Yeah.
Yeah, so it took
Okay.
them about a week to
To
get the
repair.
machine
Did
running
they
again. Yeah,
did
to
they
repair
charge you
that.
for
Yeah.
that?
No, I mean they did not charge us anything. They're nice people, but they said please let
Yeah.
us know if you're actually
Next
giving
time.
us some. Yeah, next time. Yeah.
Yeah. Yeah. They
Okay.
need. Yeah. We started giving disclaimers. Be careful. That's it. Okay.
Okay.
So
Okay, thank you
I think
everyone. Good
this
Thank you,
night.
ends here.
everybody.
Okay.
Thanks
Bye
for
bye. Yeah.
joining.
Yeah.
Take care.
Bye.
Bye.